Hello, and welcome to the UCI Health Post-Transplant Home Monitoring Education video. The UCI transplant team is very excited for you and your new transplant, and it is our goal to set you up for success on your transplant journey. In this video, we will cover some of the items you will need to complete at home in order to help us provide the best care that we can for you and your new transplant. So, what is home monitoring? Home monitoring refers to keeping track of items related to your transplant at home, such as monitoring your blood pressure, heart rate, temperature, weight, fluid intake, urine output, and if directed by your transplant team, you may also need to monitor your blood sugars and surgical drain output. In this video, we will go through each of these items and how you can monitor them at home. Prior to discharge from the hospital, our team will work with you to make sure that you have all of the supplies needed for home monitoring. We will provide you with a binder with home monitoring logs, a blood pressure cuff, a thermometer, a urine measuring device, which will either be a urinal or a hat. And if needed, we will also provide you with a glucometer and drain supplies. At home, you will also need a scale for measuring your weight. Now let's go through each one of these home monitoring items in a little bit more detail. We'll start with blood pressure. In order to get accurate blood pressure readings, it is important that you check your blood pressure before taking your blood pressure medications. You should have no caffeine, exercise, or alcohol within 30 minutes of checking your blood pressure. And you want to make sure that you rest at least 5 minutes before checking your blood pressure. You also want to avoid talking while taking your blood pressure, as this may lead to inaccurate readings. After transplant, we would like for you to check your blood pressure at least 3 times each day in the morning, afternoon, and evening. We would then like you to write down the values that you get in your vitals log. As you can see on the right side of the screen, this is a sample of the vitals log or the worksheet that you will have in your binder. We have provided you with a column to write down your morning blood pressure, your afternoon blood pressure, and your evening blood pressure. When you record these numbers, we would like for you to record both the top and the bottom number. And we would like for you to notify our transplant team if you notice that the systolic blood pressure, which is the top number, is more than 180 or less than 90 when taken 3 different times. Now let's talk about heart rate. So you can actually check your heart rate at the same time that you check your blood pressure. And then you can write it down in the same columns for the morning, afternoon, and evening. We'd like you to notify our team if you notice that your heart rate is less than 50 or more than 100. Temperature. After transplant, we would like for you to check your temperature at least 1 time each day, around the same time each day. So, for example, if you want to set up on your schedule that you always check your temperature along with your morning blood pressure, that's great. Or if you always want to check it in the evening, that would be just fine too. We just ask that you try to check it consistently around the same time each day. You may also check your temperature any other time that you feel you need to. For example, if you think you might be coming down with a cold or getting sick, go ahead and check your temperature. We would like for you to record your temperature values in the temperature column on your vitals log and notify the transplant team if you notice that your temperature is more than 101 degrees Fahrenheit. Weight. So it is important after transplant to weigh yourself every morning after going to the bathroom. So make sure you do this after you've emptied your bladder. We would then like for you to record the value in your vitals log and notify the transplant team if you notice a sudden increase or decrease in your weight. Fluid intake. After transplant, we would like for you to record how much fluid is going into your body as well as coming out of your body. So on this slide, we're going to talk about what's going into your body. So every time you eat or drink fluid throughout the day, we want you to measure it and write it down. You will record it in your fluid intake log. And at the end of the day, you can add up the values to get your total fluid intake for the day or your 24-hour total. So in this example, this person measured and wrote down that they ate or drank 150 milliliters of fluid. And then later they had another 200 milliliters and then 350 milliliters, and so on and so forth throughout the day. At the end of the day, they added all of these numbers up and got their total fluid intake for the day, which was 2,175. Your transplant team will provide you with the recommended amount of fluid that you should be eating and drinking each day. And we would like you to notify our team if you are unable to drink or eat the recommended amount of fluid each day. Some other helpful tips for fluid intake is that we recommend using a marked water bottle or other measuring device to keep track of how much fluid you eat or drink throughout the day. We understand that it's very difficult to know how much you're really eating or drinking if you're not measuring it. Cups are all different sizes. A bowl of soup may have different amounts of broth depending on what it is. So that's why we recommend using an actual marked measuring device. And be sure to include all fluids that you're consuming, like water, broth, jello, coffee, tea, anything that's fluid that's going in your body should be measured. And as a reminder, we ask that you keep your logs in milliliters, which is the same as cc's. Most measuring devices, though, have millimeter marks. So we ask that you keep your measurements in milliliters and try to avoid writing it down in ounces because that leads to some difficulty in converting and trying to figure out how much you actually drink. But we can do it if needed. But just try to be mindful about keeping it in milliliters if you can. Now, urine output, this refers to the fluid leaving your body. So after transplant, we ask that you measure each time you urinate with either a urinal or hat. And please remember, this is only for usually the first few months of transplant. This isn't forever, but it is important to help us to know how your transplant is functioning. So just like the fluid intake, you'll write down the total amount for each void or each time that you urinate. So in this example, the person voided 150 milliliters of urine. And then later in the day, it was 200 milliliters and so on, so that they got their total urine output for the day was 2,175 cc's or milliliters. And for your urine output, we would like you to notify our team if you notice that your urine output is decreasing or if you stop urinating altogether. We also want you to notify us if you have painful or difficult urination or if you notice any blood in your urine. Blood sugars. Now, depending on your medical history, you may or may not be asked to check your blood sugars after transplant. If you are advised by our team to check your blood sugars, we would like you to check and record your sugars before meals, at bedtime, and any other time you feel that you need to. We'd like you to also record how much of each kind of insulin you used for that day. So, in the example that you see on the right, this person checked their blood sugars for each meal. So, breakfast, lunch, dinner, and again at bedtime. And then they wrote down the total insulin that they used that day. So here you can see that they used 12 units of regular insulin, which means that they probably used about 4 units with each meal or some sort of combination with meals that ended up being 12 for the whole day. And then they also used 10 units of Lantus or a long acting insulin at nighttime. And so they wrote all of the insulin down that they used for that day in this column. We would like for you to notify our team if you notice that your blood sugar is more than 400 or less than 70. And we also remind you to be sure to have enough test strips and supplies at all times. Stay on top of your medication refills and also please stay on top of your refills for glucometer test strips and supplies. Surgical drains. So you may or may not be sent home with a surgical drain, but if you are, it is important to monitor how much comes out of that drain every day until it comes out. We would like for you to monitor it and write down how much comes out of the drain. So you will be provided with a surgical drain or what we call a JP output log. And as you can see here, this person had 20 cc's or 20 milliliters that came out of their drain for that day, and they wrote it down here. We would like for you to contact our team if you notice that you're actually getting a significant increase in the amount that's coming out of your drain. We would also like you to contact us if you notice new or bright red blood in your drain. In summary, home monitoring is important for the success of your transplant. All of these items that you're keeping track of at home, all of this homework that you're doing provides the transplant team with valuable information that we can use in decision making to provide you and your transplant with the best care that we can. It is also important to keep accurate home monitoring logs. So we strongly encourage you to use measuring devices and to keep track of your items as accurately as possible. We encourage you to ask questions. If you need help or don't understand any of these home monitoring items, please reach out to your nurse coordinator or anyone on the transplant team so that we can work with you to make sure that you are successful in home monitoring. We also remind you to bring your home monitoring logs and your whole notebook to every clinic visit until the transplant team says that you can stop. We usually keep track of all of these monitoring items for the first few months after transplant, but we want you to keep doing them until we officially tell you that you can stop. That is the end of the home monitoring video, but we encourage you to call us, send us a message, reach out to us in clinic, wherever and however we can be of service to you. We thank you for your time and we wish you all of the best of health and success on your transplant journey. Thank you.